We have an extraordinary situation. There are 24 million people who use a tablet, an iPad or a tablet in the UK at least once a month. 24 million, that's over a third of the population. And 93% of all people in the United Kingdom have a mobile phone, and many of those have a smartphone. So in their own lives, they're used to the idea of technology being pervasive and being something they use all the time. It used to be that the NHS was at the cutting edge of the use of technology, the introduction of technology into healthcare. But sadly, what's happened is, in our own lives, it's overtaken where we are with the NHS. And I think the really surprising thing is how the NHS needs to catch up with that. But if it does, what a really important difference it can be making to enable us to deliver prudent healthcare. I think the nature of IT is that it's something that enables other things to happen. And so, if you like, it's part of the infrastructure, part of the foundations of all the rest of the prudent healthcare agenda, the prudent healthcare proposals. So you will find examples in the chapter of how IT could make many things happen that colleagues have talked about in their chapters. There's a specific link to the chapter by Professor Ronan Lyons of the importance of using information, but actually, more generally, the importance of delivering safer care, avoiding harm, identifying error, empowering citizens with information that they can use both to manage their own health, but also to interact differently with clinicians. And finally, using IT to make sure that we're delivering care that is meeting people's needs but not exceeding it. All of those are in the chapter, and therefore are applicable across all the other chapters of this book. It is, if you like, one of the kind of core principles of prudent healthcare. I think that for us to be successful in delivering prudent healthcare, we have to transform the way we work, and in particular transform the relationship between citizen and patient and clinical staff. It used to be that clinicians held all the knowledge about a patient's condition, and they imparted that in a way that was intended to help patients understand. We then got the internet and the use of IT to allow patients to do their own research, to understand a bit more about their own condition. But what has really changed, I think, is that for many conditions, particularly long-term conditions, people are now collecting their own information about it, their own physiology. There is a plethora of devices, for example, lifestyle and healthcare devices, that you can now buy cheaply that will allow you to measure all sorts of physiological parameters. And so there is a power change in the information situation. You have patients coming to clinicians with 6 months of their own personal physiology on a stick, as it were, and handing that to the clinician and saying, there you are, that's me. Now, what does that say about my asthma or my diabetes, and so on? So we are going to become interpreters of knowledge, and that will change the relationship, and it will lead to better co-production. So it's a really good example of how information and informatics IT is power changing in terms of the relationship.